This is deep transverse friction for your anterior talofibular ligament. So deep transverse friction is used to break down scar tissue after an injury. And so if someone has had a previous injury to their lateral ligaments, and specifically their anterior talofibular ligament, we would want to do deep transverse friction to that point. So we find the anterior talofibular ligament in the gap between the anterior lateral malleolus, so the end of the fibular bone, and the anterior talus. So we sink into the gap between those two bones, and if someone had had an injury there and there was scar tissue, then we're going to be feeling for thickening and for patient discomfort or pain on palpation. We're going to sink into the tissue with reinforced fingers. Put the tissue on a slight stretch. So to stretch the ATFL, we would take the foot into inversion. With reinforced fingers, sink deep into the tissues until we actually feel resistance of the ligament. And at that depth, we would then friction transversely across those fibers. So at depth, we're going to friction back and forward. And we're going to continue that friction for 60 seconds or until we feel numbing of that tissue. You would always want to warn the patient that there may well be discomfort, and this may cause bruising because we're breaking down bonds in the fibers. So after 60 seconds, I would check that that had numbed off. Okay, and then I would come off. Just take the foot back into neutral and allow the area to rest for about 30 seconds. At which point I would then go and repeat exactly the same thing. So put the ligament on a stretch, sink down into the fibers and friction across the fibers at 90 degrees, so transversely. Again for another 60 seconds. And we would repeat that whole cycle in total for 10 minutes.